Hi everyone and welcome back to the channel. Today's video is all about a super common question that almost every couple trying to conceive asks: how long does it take to get pregnant? We're going to cover what's normal, what factors affect fertility, and when it might be time to seek help. So grab a tea, get comfy, and let's dive right in. Let's start with the basics. The average healthy couple has about a 15% to 25% chance of getting pregnant each month if they're trying regularly. That means, for many couples, it can take up to a year to conceive naturally, even without any fertility issues. Here's what the stats look like. About 30% of couples get pregnant within the first month, around 60% within 3 months, nearly 80% within 6 months, and by 12 months, around 85% to 90% of couples will have conceived naturally. So if you're a few months into trying and still not pregnant, take a breath. It's totally normal and you're not alone. One of the most important pieces of the puzzle is timing. Ovulation is the window when an egg is released and can be fertilized by sperm. This usually happens about 14 days before your next period, but it can vary depending on your cycle length. Here's a quick tip. Sperm can survive inside the female body for up to 5 days, but the egg only survives for about 12 to 24 hours. So having sex in the days leading up to ovulation and on the day of ovulation gives you the best chance of conceiving. There are also ovulation prediction kits, apps, basal body temperature tracking, and cervical mucus observations that can help you figure out your fertile window. What affects how long it takes? Now, let's talk about some of the factors that can impact how long it takes to get pregnant. There are 5 main factors. Age. Fertility declines with age, especially after 35. Women in their early 20s have the highest monthly chance of getting pregnant, but by age 40, that chance drops significantly. Health and lifestyle. Things like being overweight or underweight, smoking, heavy alcohol use, high stress, and poor diet can all affect fertility for both partners. Cycle regularity. If you have irregular periods, it might be harder to predict ovulation, making it more challenging to time intercourse correctly. Underlying medical conditions. Conditions like PCOS, endometriosis, thyroid disorders, or low sperm count can make it harder to conceive. Sometimes couples don't even know these issues are present until they start trying. Frequency of intercourse. It's recommended to have sex every 2 to 3 days throughout your cycle, not just during the fertile window, especially if ovulation is hard to track. When should you seek help? This is a big one. When should you talk to a doctor or fertility specialist? Here are some general guidelines. If you're under 35 and have been trying for 12 months without success, it's time to consult a doctor. If you're over 35 and have been trying for 6 months, don't wait. Book that appointment. And if you're over 40, it's recommended to seek help right away if you're trying to conceive. Also, if you have a known condition like PCOS, very irregular cycles, or if your partner has a history of fertility issues, don't wait. Reach out to a healthcare provider early on. Remember, getting support doesn't mean you've failed. It means you're being proactive and getting the tools you need to help your journey along. What happens during a fertility checkup? You might be wondering, what even happens at a fertility appointment? For women, doctors will usually review your medical history and menstrual cycle, possibly run hormone blood tests, check for ovulation, do an ultrasound or other imaging to look at ovaries and uterus. For men, a semen analysis is often done to check sperm count, motility, and shape. It's usually simple, and the info you get can be really helpful in figuring out your next steps. What you can do in the meantime. While you're trying, here are a few things you can do to support your fertility. Take prenatal vitamins, especially folic acid. Eat a balanced diet with plenty of nutrients. Exercise moderately. Reduce stress. Yes, I know, easier said than done. Limit alcohol and avoid smoking and drugs. Get enough sleep. Also, involve your partner. Sperm health is just as important. Encourage them to eat well, manage stress, and stay healthy too. Final thoughts. So, how long does it take to get pregnant? The truth is, there's no one-size-fits-all answer. Everybody is different. Some couples conceive right away, while others take months or even years. The important thing is to understand what's normal, track your cycle, make healthy choices, and seek support when needed. This journey can be emotional, exciting, and sometimes frustrating, but you're not alone. Whether you're just starting out or you've been trying for a while, I'm here to support you every step of the way. If this video helped you, give it a thumbs up and don't forget to subscribe for more content like this. Sending you lots of love and baby dust. Thanks for watching, and I'll see you in the next video. Take care and stay hopeful.